Here's the mandible. Here's the body, the ramus, the angle, the mandibular notch, the condyle, the coronoid process, the mental foramen, the mandibular foramen, and the alveolar process and the lower teeth. Here's the frontal bone, and here's the superciliary arches, the supraorbital margin, and the supraorbital foramen. Looking at our maxilla, we have our alveolar process and our upper teeth, and our maxillary sinus will be deep in there inside the bone. And inferiorly, we have the palatine process and the palatine bone, and then inferior to the orbit, we're going to have the infraorbital foramen. Here we have the squamous part of the temporal bone, the mastoid process, where the styloid process would be, the external acoustic meatus, and the mandibular fossa. Here's the zygomatic bone, and we have the frontal process, the maxillary process, the temporal process, and the zygomatic arch. Looking at the sphenoid bone, we have the greater wings, the lesser wings, and in here in the body, we're going to have the sphenoid sinus. In the ethmoid bone, we're going to have the cribriform plate with olfactory foramen and the crista galli in the middle. Also part of the ethmoid bone are the superior and middle concha. Here we have the foramen magnum, and part of the accessory nerve will pass through here. We have the jugular foramen, and the vagus, accessory, and glossopharyngeal nerves will all pass through there. We have the hypoglossal canal, and that's where the hypoglossal nerve will pass through. Here we have our stylomastoid foramen. That's where part of the facial nerve will pass through. Then we have our carotid canal, and that's where the internal carotid will pass through. Here we have the internal acoustic meatus, where the facial and vestibulocochlear nerves will pass, the foramen spinosum, where the middle meningeal artery will go, and the foramen ovale, where the mandibular nerve passes. Then we have the foramen lucernum, and the foramen rotundum, where the maxillary nerve passes, and the superior orbital fissure, where the abducens, oculomotor, and ophthalmic nerves all pass through. Then we have the optic canal, where the optic nerve will pass through, and anteriorly and superiorly, we have the cribriform plate, where the olfactory nerve will sit.